Three. Yeah. Good afternoon, everyone. I'll be having a session on IUI lab setup and beyond as per the new ART rules. So since you all are practicing clinician, I'll not be going in much into the detail. So I'll be brushing up regarding the IUI, why we do, and what are the things that is required as per the new ART law, and how we can set up a better IUI for a better optimized outcome. So as we all know that IUI is having a mere success rate of around 5 to 10%. Sometimes it can speak up to 15% based on the etiology of the patient. So let's begin with what is IUI. So the reason why we need IUI is to have a very much highly motile fraction of sperms to get it fertilized. That could be due to the in hostile environment by the uterus, or very viscous sample that it is not diluting, or there could be so much of leukocytes that is being being present in the ejaculate. So there are many other reasons where we are performing IUI as a primary primary mode of treatment for fertility. So what we actually do is we remove the sperms from apart. We remove the sperms from the ejaculate. Ejaculate is nothing but it has all the WBCs, epithelial cells, and sperm and Sertoli cells, and other type of cells. Along with that, you have the factors, that is secretory hormones, that is prostaglandins and other hormones. So what actually does is, why the processing is required in terms of IUI is to remove the prostaglandins. So what actually happens when we are directly going into the uterus and depositing the sperm without any pre-preparation, the probability of infection is more. And due to presence of prostaglandin, what actually does, it will contract the uterus. Due to that, the conception might not happen because the contraction of uterus is happening. So what we are actually doing, we are having two or three types of processing. One is density gradient, where we are layering the sperms, where we are layering the density gradient media, and above that we are layering our semen sample and processing it at a centrifugation at a speed of 1200 RPM with 12 minutes, and then we are washing with a buffer. And at the end, we will be getting a pellet which is of high fraction of motile sperms. So that will be taken 0.3 ml of processed sample, and we will be assisting the consumption through IUI. So here the rational near to, it is, we are actually enhancing the chances of fertilization by doing IUI. So according to new law, we require all the followings for level and level 2 clinics. So the level 1 requires reception area, waiting area, consultation room, storage space, record space, MRD room, examination room with privacy that has USG scan machine as well, where you need to have PCP license and fire NOC and fire NOCs and a trade license. And backup power should be there always. That should be connected to our USG machine, as well as all of our equipments in the andrology lab. And also particularly a focus should be always given on our refrigerator, because that is the least bothered, because the if there is a miss of cold chain, you are, if the power backout is there and you don't have a power backup, and the refrigerator is shut down for almost 4 hours, the temperature will drop. Obviously, the cold chain will be interrupted. Thereby, the quality of that drug, whatever you're giving for stimulation, as well as the media that is used for preparation, will be compromised. So thereby, you will not have a good result out of it. So fire safety arrangement should also be there in terms of emergency. If you have all these things, then only you will be getting the license. And if at all, if you want the pathology lab, you also can have that. And IUI room, semen collection room, and andrology room should be adjacent to each other, where the collection will happen at one room, and thereby through the post box it will be transferred to the andrology room where the processing will take place. From the andrology lab, there should be a pause box to a IUI room that has to be given by having the labeling done, and the name has to be told loudly where the patient can recognize that their sample is being used. And sterile area for all your like for autoclaving CCST room and processing laboratory and autoclave area. So these are the things that is required as per the new ART law. Apart from the layout and the rooms that is required, you also should have a grievance room where the patient can come and give you any complaint regarding the services or regarding the treatment, and that also has to be documented in a register called grievance register. Apart from that, you should have there is a format for grievance also in ART rules book. You can download that and you can give it to a patient. And the staff requirement for level 1 is one gynecologist. The gynecologist should be having a postgraduate in obs-gyn, and staffing of and andrology technician who is trained well enough to do the processing. So apart from, three pillars of a level 1 clinic, that is infrastructure that has to be organically designed, and the equipment that you will be choosing should be proven one, and it should last more than a year or two without any breakdown. And the personals who will be handling your patient's gamete should also be trained well enough before you begin level 1. So the team that includes gynecologist, sonologist if required, andrologist or embryologist if you are planning for level 2, and the counselor should always be there, and the counselor should also have the knowledge of IUI and all the preliminary treatments. Apart from that, you also can have a psychological counselor where the patient can be counseled for a better conversion. So the success rate of the center is depend upon the efficiency of the team. As I have told you that the power backup should be there because the cold chain has to be maintained for all the medias and drugs and everything. If that is compromised, then all the cycle which you are going to do is getting compromised, because the minimum requirement for the cold chain to be maintained is 2 to 8 degrees Celsius. So if it is going beyond that, the metabolite activity will start in the media, and thereby it will create an ammonium formation, and thereby like obviously the peptide will break down to ammonia, and when the ammonium rises, the pH will also be rises in the media. Thereby it is not suitable for the sperm. So there are ICMR guidelines and ART guidelines. ICMR guidelines is the old one, but now since we have ART law, as I have already told you, in the ART law, what is the requirement for the staff requirement and the qualifications. So the non-medical members are also the important from this big, to start from our watchman to the front desk to the good IVF nurse who can take care of your patients, and andrologist or embryologist who will be actually be a key player for your program for successful pregnancy. Apart from that, the sterility of the area also makes a very huge difference. The gynecologist, as I have told you, that they should have a postgraduate or additional diploma in obs-gyn, understanding the causative factor of, and the gynecologist should have a good, well enough knowledge about treating ART, for fertility patients, which is a causative factor of male and female infertility. Knowledge of practice and use of diagnostic method for determining the cause of infertility, knowledge and clinical aspect of reproductive endocrinology, and competence in gynecological ultrascopy. Why there it is required? We also always know that there are space where we still not know why the patient is not getting conceived. That's a fertile patient. There could be many causes. It could be due to endocrinology, or it could be due to this reproductive immunology, or it could be due to a simple factor that is any tubal block or something that you will be assessing through a gynecological ultrasound scanning. And intervening, now obviously they will be doing, the gynecologist will be intervening and understanding the history of the couple, physical examination if it is required for the male and female, recommending appropriate test for all the baseline hormone test, carrying out of endoscopy or saline USG should also be done for tubal patency, and doing IUI, I mean assisted insemination, or AID, that is donor sperm. So andrology is subject related to male reproduction. In India, there is no formal course for that. It is urologist or surgeon that often takes the treating of male infertility. They must also have to take whoever you are treating doctor for andrologist should also have a knowledge, I mean, detailed knowledge about male infertility before they actually go into treating male patients. So this is for senior embryologist and junior embryologist qualification if you're going ahead with the level 2. So coming back to sterile and non-sterile area. So as we all know, the processing and everything has to be done through a aseptic area where there should be no nil contamination, as well as the catheters and the medias and disposable that you will be using that should not be spermicidable. So actually the latex glove that you will be using for insemination or the processing is actually spermicidal that many people are not aware of. So it is always advised to use paper glove or latex free, latex free and powder free glove. If you are having that as an option, you can, obviously there is a cost which incur to that, but it is always advised to use a powder free latex glove. And as a part of like examination room, you should have a privacy to it. If the male or female partner is examined, general purpose laboratory, that is pathological laboratory, storeroom should be essential for IUI media and disposable catheter, because that also has to be stored in a certain temperature. So if the temperature of that room is rising beyond the room limit, then the probability of that catheter or the disposable actually tend to its chemical activity. So thereby it also can be spermicidable. So whenever you are choosing any consumables and medias, try to see that the consumables and the medias is MEA tested, mouse embryo assay tested. So if you are having that as a certified, then you are feel free to go and purchase that. And always remember to use, to go through the go through the manufacturing details and manufacturing guidelines as well, where to store and when to store and what is the time frame that you can use it. Because media has a shelf life of around 7 days. Beyond that, if you are using all the pH and the bioactivity of that media will change. So the record room should also be automized and computerized. That includes history, diagnosis, treatment, and freezing details if you are doing any. And the autoclave room for sterilizing and autoclaving, and the CSSD register is mandatory over there. And when we are talking about, just a minute. Yeah. So the place should be vermi-proof step where the whole area is that should be suitable to trap insects or unwanted creatures that is entering the room. Semen collection room is well appointed room with privacy, because the male partner often have a issue with privacy issue, like someone knocking the door or walking through that. So due to that fear or uncomfortable situation, the patient could not able to collect the sample most often. So though the patient prognosis is normal, if the room is not adequately private, the patient will not collect the sample. In that regards, we have to ask the patient for coitus interruptus. But still, when we have an option of giving them a private room, then it is always good for the sperm collection, where there will be no changes in their parameters when they are collecting. And the collection room, as I have told you earlier, the collection room should be close to the laboratory, and so that the privacy can also be maintained and the flow of the procedure can also be taken care. And the procedure of the semen collection should be, the collection container should be sterile, not the normal what we use is for a stool sample collection or urine collection. So there is a semen collection pot which comes for only a semen collection. I mean, the collection container which is specified for semen collection. So that also should have a wide mouth. The reason is when they are ejaculating the sperm, they might have to, I mean, there is a probability that they will spill the sample here and there. So better to have a wide mouth container and a non-toxic container, as I have told you, that is specific to the semen collection. The room should have a wash basin with soap and tissue, and that is attached to a toilet. And make sure the patient doesn't mix the sample, or the patient should not have any use of any lubricants, because it is also spermicidal. Or if the patient is not able to ejaculate through masturbation, they can always choose a coitus interruptus. If there is a chance of a patient depositing the sperm inside the uterus, I mean inside the vagina, then you can use this non-spermicidal condoms for the collection. Great table for lithotomy position and doing IUI. And there must be separate room for laminar airflow for, I mean, we are talking about IUI lab, where the room a sterile area should also, so by considering having that, you should have a clean room, or else that laminar airflow in due course of time, it will get clogged. So the approximate area for a IUI lab should be 100 to 200 square feet area. It is preferably to have a lab adjacent to nearby IUI room and the semen collection room. It is also important to take care of all the electrical wires should be concealed, not protruding outside. It is better to avoid false ceiling, because that has a POP inside that is known to have mold growth, as well as I mean during moisture season, or I mean during monsoon season due to moisture, or it also could emit VOCs that is not good for either gametes. And a split or a central AC is preferable, because the equipment that you will be using, like our centrifuge or the microscope or refrigerator. So actually, to have this contained in this particular temperature, you need to have the room at 24 degrees Celsius, or else the refrigerator temperature or the incubator temperature that you will be storing your sample will elevate according to the room temperature. So it is always better to have a centralized or split AC. So the floor should be covered with large marble tiles instead of a small one, because the grooves in between the tiles are known to deposit for all the dust and microbes. So while cleaning, we will miss out. So it is better to have a large tile or a granite tile. So alternative to that, you can also have vitrified tile, or if you're not going for that as well, you can have a sheet, vinyl poly sheet. That is easy to clean and that is easy to maintain as well. The wall also should also be covered with tiles, because it is easy to clean, and the growth of microbe will also be limited in that, because normal wall will have pores that you can't see, and in that you can see the molds forming, and that also can lead to a contamination. So in the andrology lab should be covered. It should not have any windows per se, because the visible light has some part of UV that also can affect your sperm DNA. So if you are having if you are having a window in your laboratory, try to have a curtain on it while processing the sperm or anything, or else the UV that is emitting from the outside actually can damage the sperm DNA. Also, you have UV light for sterilization in laminar airflow. It is always advised not to switch it on while work. It is preferably one should have a scrubs which is steriled frequently every day, and the cleaning should be done by 7x solution or any mild detergent solution which is not emitting VOCs, followed by all our uh, like distilled water. Strict adherence to hygiene is very important. Protective laboratory cloth, that is hairnet, is very much important because hair also can carry out contamination. As I have told you, non-powdered glove with the minimal latex can also be used, and mask is mandatory. And food, gum, drink, and tobacco strictly not permissible. It is strictly prohibited inside the laboratory area. Cosmetics should be minimized and perfume should be avoided because it is spermicidal and gametose. For sperm assessment and sperm preparation, you need a macular chamber where you will have 100 boxes. That is how we will be giving, we'll be counting all the 100 boxes or alternative 30 to 50 boxes in order to give your count. And to view that, we need a microscope, which is phase contrast microscope with 10x, 20x, and 40x magnification. Centrifuge with swing out rotor, not the fixed one, should be preferred. If you're having a centrifuge which can maintain the 37 degrees Celsius, there are centrifuges which comes with maintain, temperature can be maintained at 37. If you're having option, then you can also go for that. Dry incubator to maintain a sample at 37 degree because the liquefaction happens at 37 degree only. The liquefaction time is around 0 to 1 hour. So the sample should be liquefied either at room temperature. At 37, the activity of liquefaction is more than the room temperature. It is preferably to have a dry incubator to warm our consumables, to warm our media to 37, and for the liquefaction as well. So the test tube warmer is also to maintain the continuous gradient of 37 when you are working inside the laminar hood. So the laminar hood should be either horizontal or vertical. And as I've told you, wide mouth jars for sperm collection, cryocan if you are having a cryo program planned. So the essential things that has to be bought: centrifuge, laminar airflow hood, microscope, incubator, test tube warmer, and desirable phase contrast microscopy, macular chamber, CO2 incubator if you want, and experimental CASA. The counting can also be done at slides. So that is why, because macular chamber is costing somewhere around 70,000. If you are willing to invest on it, you can invest on it, or else you also have a choice of just viewing it a microscopic slide. That also makes sense. But for a beginner or a mid-level, they can't able to exactly give what is the count. It is always better to have a macular chamber in place. So the macular chamber is a magnified version of the WBC counter. So yeah, there's a compound microscope with 10x, 20x, and 40x for viewing the sperms and count. And you have the REMI or temperature gradient centrifuge with outrotor, and dry incubator which can maintain 37 throughout. Kindly go for a branded one rather than a small one, because the sensor in that bacteriological dry incubator actually tend to deteriorate after a year. So if you are going for a dry incubator, kindly opt a better one. So there's a CO2 incubator that is not required for level 1. So this is the laminar hood where we will be working for semen analysis, which will be filtering out the environment with the sterile air, and the cryocan and the laminar hood with a microscope. There's a bare minimum setup that is required for a level 1 clip. So the media that we'll be using, the buffer that we'll be using, is simple balanced salt solution that is made of Earth's balanced salt or ETF buffer, or that will also be phosphate, PBS. So the buffer is actually mixed with antibiotics as well to prevent the contamination in the media. And there is something versatile called HEPIS that actually withstand the change of pH according to the temperature or the environment. So the composition of that HEPIS media does have a phenol red, which actually help in guiding us the pH of that media. If it is yellow, that means it is acidic. If it is dark pink, that it means it is alkaline. So we need an optimal pH of about 7.2 to 7.4, that is baby pink color. So the osmolarity between 7.2 to 7.4 pH has a value of around 280 millimoles. So this is the disposable that we'll be using, the conical tube, the round bottom tube, and the collection container and IUI catheter, which comes with syringe. And it is also to note that the syringe plunger, the black one, as you can see here, that is also actually a spermicide. So if you are actually using this, try to have an air gap before you take the sperm, processed sperm, or there are injector which comes without this black latex plunger. The key factor for success results depend upon strict quality control, can also be achieved by monitoring air quality, instrument performance, and parameter checks. So to check all our equipments are working fine with the temperature, starting from the temperature, starting from the air quality that is being supplied into the laminar hood, also determine the success. So the conclusion, successful IUI program completely depends on the experts of hand that is majorly composed of the doctors, then the andrologist, and a clean room with sterile maintenance and proper instrumentation, disposables and medias with proper AMC done, annual maintenance service done, and quality check, quality control, and quality assurance and standard SOPs, standard protocols. These are the references. If you want, you can do it. Thank you. If you have any questions, you can please pitch in to ask. So I assume that everyone have understood. So I'll take a leave now. Thank you so much. Thank you. Thank you so much.